Morning, everybody. Welcome to Drive with John on November 6th. It's a beautiful day today. We got some good weather for the weekend, which is nice. It's been a very busy week here in Acton. Big election on Tuesday. After 2 weeks of early voting, our team put together a flawless election on Tuesday over at the R.J. Gray Middle School. We had, let's see, I just had the number, I lost it. We had 2,452 people come through that day for voting, which is about just under 15% of the population of registered voters. Prior to that, we had 67% of people cast votes either through early voting or through mail-in voting. So the overall turnout was 81.7%, 13,600 people, which is a tremendous turnout. So it's nice to see people exercising their rights to vote. And I really appreciate the work of Eva Skaderic and Gail Sawyer and all the team members that run our elections, the election workers that are here every year. And then this year in particular, we had dozens of staff from throughout the organization working as poll workers. And I spent some time over there on Tuesday and also during the primary. And it was really nice to see people from the library, people from all over the organization working and helping our residents vote. So thank you to everyone that participated. And other things happening. We've had a couple public forums that we've been trying to promote. There was one last night regarding how we're going to potentially reuse the Maple Street property next to the train station. And there are more coming up next week, including one about how to reuse Asa Parlin House, which is the yellow house behind Town Hall. So those are sort of some brief updates from me today. And then we're going to get right to our guests because they have some important information to share. Some big public health changes this week from the governor. Governor Baker made some announcements earlier in the week that took effect today. And Heather York, the director of Acton Nursing Services, and one of our public health all-stars is going to share with us some of those new restrictions and some other updates on public health. Good morning, Heather.
Morning, John. Good morning, everyone. So a couple updates prior to getting to the new guidelines that Governor Baker put out a couple of days ago that are effective starting 12/01 today. The numbers in Acton for COVID since March. We have 240 positive cases overall. Currently, 16 people are in isolation. We are having a couple flu clinics between today and tomorrow. One last high-dose flu clinics for seniors 65 and above is today at 30 Sudbury at the Human Services and Senior Center building. 1 to 4, you can go to ActonNursingServices.com and book your appointments still. It'll ask you to fill out the form, so you can do that online. And then we have our big flu clinic, town-wide flu clinic tomorrow at the DPW building on Forest Street. It is 9 to 1. We're asking people to have their paperwork filled out and make copies of your insurance card. The clinic is for 9 years old and above. And we will not have high-dose vaccine there because we have a very limited amount that we have for today's clinic. So those are two things that are going on. I'm thankful, as John said, the weather is going to be nice. It'll be 70 for the flu clinic in November. So I'm very happy about that. So the governor put out new guidelines for COVID-19 that went into effect at 12:01 this morning. So they are as follows. There's a stay-at-home advisory. All residents, again, are asked to stay at home between the hours of 10 p.m. and 5 a.m. You should only leave your house if you're going to work or to school or for essential needs such as grocery stores, pharmacies, or emergent care if you need to see a doctor. Face coverings are now a mandate wherever you are in public, whether it's indoor or outdoor in any public building or space. as well as vehicles for people that don't live in the same household, who may share a vehicle for work. So this is a revised order based on the previous order, and it has you wearing the face covering regardless of being able to social distance. So there have been a lot of questions and concerns over the last few months about outdoor locations where folks, as an example, the rail trail, folks were not wearing face coverings while on that because they could socially distance. But now the mandate for something like that is that you do need to wear a face covering. Anyone 2 to 5 years old does not have to wear a face covering if they cannot tolerate it. No one under 2 should wear a face covering. And then again, there still are exceptions for anyone that has an underlying condition, whether it be medical or behavioral, that they cannot tolerate a face covering. And again, you cannot be asked to prove that to get into a store or doctor's office. So that is the face covering. The other thing that goes along with the stay-at-home advisory is the early closing of most businesses in Massachusetts at 9:30. So they have to close at 9:30 and not reopen until 5 a.m. Some of those are restaurants, liquor stores, indoor and outdoor events in different communities, theaters and movie theaters, and that includes drive-in theaters, youth and adult amateur sports, golf facilities, and then it goes through all the outdoor recreation experiences, which most of those in Acton close at dusk anyways, so that shouldn't be an issue for us in Acton. Gyms, fitness centers, health clubs, indoor-outdoor pools. So those are places that will need to close at 9:30. The other piece that the governor put in place is gathering limits that require social distancing of at least 6 feet at all events, and of course wearing a face covering. And that the only exception is between members of the same household. So they are recommending that anyone in a private residence limit their indoor gathering to 10 or less. If you do not have people within your own household, if you're having people from outside of your own household, you should still be social distancing and wearing masks while you're inside. And then the outdoor gathering is 25 people, and this is for private residences. I know this is a challenge with the holiday season coming, since we are in November and Thanksgiving's only a few weeks away. So it's definitely something that folks should think about and plan ahead for now that that's out. The other gathering limits have changed also. Public spaces and event venues not only have to close at 9:30, but they're limited to 25 people indoors. Lower risk communities, which Acton still is as of yesterday. The new numbers will come out today. All communities have to have outdoor limits of 100 people for low risk. And then if you get into a high risk, the outdoor capability will be 50. So just keep an eye on the updates for any of those things. Make sure that you keep your face covering on. It should go on the moment you leave your house. If you're taking a walk, it should still be on. You can obviously take it off within your car if you're with members of your own family, but then it does have to go back on whenever you are in a public space. Definitely advisories to help reduce the spread of COVID, but they're definitely, I think, going to be a little bit of a challenge for folks as the holiday season starts. That's it for me, I think, for today.
Thank you, Heather, for the updates. It is an interesting time that we're in where we're taking these measures to protect each other. And I think one thing that we can have comfort in is that we're all doing it, and that we're all going to just work through it together. And hopefully this is the only Thanksgiving that we have to ever deal with anything like this, and just try to make it work for us the best we can, and keep up the great work. And we're gonna keep using our masks, masking up everywhere we go now. Even if you can social distance, you still need to wear a mask. So everybody will, I'm sure, will be doing that starting today. Our next guest on the program this morning is Sharon Mercurio. Sharon, as you all know, is the director of the Council on Aging and is the executive producer of this program, I might add. And Sharon, what's going on over in the Senior Center?
Good morning, John. Thank you so much. Just a reminder, because of COVID, we're still doing all of our programs virtually. So we have a wonderful partnership with ActonTV. Our regularly scheduled programs are shown on ActonTV. There's also a YouTube channel that ActonTV has. So if you are not a morning person, you can tune into your morning exercise after dinner, whatever works for you. And we've been doing a lot of Zoom programming. Today at 1:00, for those folks that have come to the Senior Center and knew Joy Aguila, we are having a send-off for her. She's leaving her position at Minuteman Senior Services. So she's been a big part of the Senior Center since I've been here. She's worked here for over 13 years. So the Zoom link is on our website, actoncoa.com. Click on that and you'll get to see Joy and say goodbye to her. On Monday, the Friends of the Acton Council on Aging will be having their meeting via Zoom at 1:00. And if you're not comfortable on Zoom, you can always call in to participate to these meetings as well. Our COA board meets Tuesday at 10. Lots happening Tuesday at 10. We have Tuesday Tips with Terry at 10:00. And then also Mindfulness with Liz at 10:00. Another classical music program, November 12th at 1. And we're going to be doing our drive-through Thanksgiving meal. That will be November 17th. We'll be having folks stay in your cars. We'll safely put the food in your car. It'll be turkey and all the fixings. That'll be November 17th. And if you're interested, if you could please let us know by Tuesday so we can get the head count, and that would be great. Wanted to give a little shout out to Jim MacRae. I know Veterans Day is coming up, and he's another guest on our program. He's here to talk about some things, but Jim's a veteran himself, and having worked with him now for several years, he really goes above and beyond helping the seniors in town. Unbelievable. For those of you, if you drive through town, you'll see all the flags in the common. Jim does that one-man show. He's out there digging the holes and sticking the flags in to honor the veterans. So thank you, Jim, for all you do.
That's a great introduction of our next speaker, Jim MacRae. James MacRae is the Veteran Services Officer for Acton. But in the last year or so, we've also expanded his role, and he's now serving as a regional director of a district comprising of both Acton and Boxborough. He did such a nice job helping our veterans that Boxborough wanted his help as well, and we made it work, and he's continuing to do excellent work here and in the region. So, Jim, thank you for your service, and thank you for everything that you do for the town of Acton. What do you have to share with us this morning?
Yes, well, good morning, John. Thank you for having me, and thank you, Sharon, for that very thoughtful introduction. So I want to take a moment and just tell everybody what's happening. Obviously, due to the COVID-19 pandemic, there will be no traditional ceremony on the common as usual, unfortunately. So that will be canceled. However, I would recommend that anyone listening should tune in to ActonTV on Veterans Day, November 11th at 11 a.m., where we will be broadcasting a Veterans Day broadcast of sorts, where I want to take that opportunity and do something a little bit different. And what I'm going to do is talk a bit in depth about two very important benefits. One is a state benefit known as Chapter 115 assistance. And then I'm also going to go in depth about the various forms of service-connected disabilities. And this is something that I assist veterans with in my office, that I've I've got a good amount of experience with. And so for any veterans or other who are curious about this, I recommend that you tune into ActonTV on Veterans Day at 11 a.m. And we will also be talking about some other local veterans related happenings in town. Beyond that, I have an annual mailing that goes out to close to 800 Acton and Boxborough veterans that, again, detail different benefits, what my office provides. So that should be hitting mailboxes a little later than normal, but it should still be a couple days prior to Veterans Day. So for anyone listening who is a veteran or is curious about benefits and wishes to be added to this list that has not received a mailing, please reach out to my office and we'll definitely get you on the mailing list. And I guess just lastly, I just want to let people know that during this pandemic, it's limited what we can do and how we do things in our everyday lives. But having said that, I'm still here, I'm still in my office, and we've adapted as well. And having said that, there's a lot that we can accomplish, veterans benefits related, over the phone, via email. I have no problem making home visits, at least meeting out the front door to sign paperwork for veterans benefits we may be working together on. So with that in mind, anyone who is curious about benefits or who wants to proceed with obtaining certain benefits they may be aware of, I recommend you reach out to my office and we can definitely get something done.
Thank you, Jim. I've been meeting with you periodically since I started here, and you always have stories about benefits that you found for people that they didn't realize they had access to it as people that served our country. What's the most common thing that people are surprised to find out, the first time they meet with you, whether they're a spouse or a veteran themselves? The thing that they didn't know anything about it. What's the thing that they're most surprised to find out?
Well, I think the most surprising thing that they're unaware of, and the claim that I assist veterans the most with for disability claims, would be claims for hearing loss and tinnitus. Tinnitus usually is experienced as the high-pitched ringing in the ears. It could also be experienced as a buzzing or clicking or hissing noise. And they're unaware that they could submit a claim for that based on what their job was in the military and if it was even moderately related to loud noise exposure. So transportation, heavy equipment, infantry, anything related to loud noise exposure, that will lean heavily in your favor if you wish to submit a claim for hearing loss and tinnitus. So for hearing loss claims, if the VA awards a veteran hearing loss, they will grant a 0% award. And with that 0% award for hearing loss, entitles the veteran to hearing aids, as well as anything hearing related that the veteran needs at no cost to the veteran, which is huge because I don't know what kind of coverage is out there for anyone to cover the cost of hearing aids. And we know that they're very expensive. On top of that, if they are awarded a tinnitus, which is the ringing in the ears, no matter the severity, if it's periodic and mild or severe and constant, it's a standard 10% VA disability rating. And 10% disability rating currently is $142.29 per month, tax-free, tax exempt, a little bit of extra money in your pocket to compensate you for ailments that were incurred in your service. And on top of that 10% disability rating, people are surprised to find that there are a lot of benefits, doors to different benefits that open up for the veteran once they have a service-connected disability rating. So for one, at least to the town of Acton, state benefit, there's a property tax exemption for veterans who are rated 10% or higher, annual $800 property tax exemption. So that's another benefit that goes along with that. But the most surprising one that people aren't aware of is for a veteran who has no disability rating, there's a geographic means test to be eligible for VA healthcare. And it varies from county to county what that means test is and what the income threshold is to be eligible for VA healthcare. However, with a 10% disability rating, you could be Bill Gates and you'd be eligible for VA healthcare, so to speak. So with that 10% disability, it does not bar you from VA healthcare. I've been using it as my primary healthcare for years, and I think it's fantastic. I go to the Bedford VA, and they do great work over there. So that's something that a lot of people are surprised to find out.
So for all of you listeners and viewers at home, I think the moral of the story here is that if you serve in the military or you know somebody that did, make sure they talk to Jim, because he's got all kinds of information and knowledge and expertise about ways to help you. So thank you, Jim, for what you're doing.
And that's just one of the various forms of VA service-connected disability that I will be discussing during the Veterans Day broadcast at ActonTV. So for people who are curious, please tune in.
Thank you. We will. Well, thank you, Jim, and thank you, Sharon and Heather. Thank you, Mark at ActonTV, and Brian in the IT department here for helping produce and broadcast this program. I hope everyone can get out and take a walk, wear a mask, but enjoy the beautiful weather, and have a good weekend, everybody.